While creative thinking may work for real estate, a condition for the pharma sector may force deal makers to change deal structures. The 2016 FDI policy allows 74% investment in existing pharmaceutical companies, brownfield as it is commonly referred to, under the automatic approval route. Any foreign investment above 74% needs government approval. The policy disallows non-compete clauses and insists that for up to 5 years after the acquisition, the production of essential or NLEM drugs and R&D expenditure be maintained at the highest level achieved in the 3 years prior to the acquisition.
It's both the conditions together that are creating structure difficulties in transactions. For companies in the pharma space that are engaged in different spaces within pharma. So you could be an API manufacturer, you could be a manufacturer of generics, you could be a manufacturer of branded products, you could be a licensed manufacturer for other pharma companies. Across this heterogeneous space called pharma, when you force every company that receives FDI to preserve the highest level of NLEM drugs and the highest level of R&D expenditure in the 3 years preceding the investment, for 5 years, what you do is you make it difficult for foreign investors who may be keen to invest in one, but not all parts of an Indian pharmaceutical company's businesses, to invest in those companies. And why does that happen? It happens because a lot of these overseas corporations actually have much more focused operations than Indian pharmaceutical companies do. Frequently, these companies outside India are themselves bound by non-compete provisions on subspaces of the pharmaceutical industry that they cannot invest in.
So when you say subspaces, you mean generics, APIs, etc.?
That is correct. That is correct. What this condition does for foreign investors of that kind is, instead of making a straight equity investment in a pharmaceutical corporation in India with diversified operations, they are forced to make a business acquisition from the existing pharma company. That has its own set of tax and other costs, and it's frankly forcing them to do a fundamentally different deal from economically the most natural transaction that would have served the purposes.
Irrespective of which sort of subdivision, as you put it, you invest in, you are supposed to maintain that level?
That is correct. Okay. But if you, after your investment, wanted to hive off a division, because you're not globally allowed to be invested in that space, the policy doesn't make an exception for that. And the hive off would result overnight in the level of manufacture of NLEM drugs going down, which would be a breach of that condition. And the only way you can make that investment then, knowing that immediately after the investment you would hive off a division, is to go to the FIPB for an approval, thus effectively making what should have been an automatic route investment again an approval route investment.